Look, Helen, it's only $20 to get an acrylic manicure. What a steal!
Oh, that would be super cute. But don't you have clinical rounds tomorrow?
Yeah, why?
At work, we're not allowed to wear nails while working with patients.
Why not?
Because if you're directly working with patients, you can spread germs.
Cuticle cops.
Collaborate and listen. Helen's right. You can spread bacteria by touching your patients.
Who are you guys?
We're the Cuticle Cops, and we're here to tell you about the dangers of bacteria that spreads under your nails.
Wait, I wash my hands pretty often at work. You mean to say that bacteria can still stick underneath my nails after I wash them?
Yeah, they're so sneaky, especially under long acrylic and gel nails. They can also get stuck in the crevices of your nails too.
I didn't think about that.
That's okay because now you know, and we're here to show you how that happens.
Take a look for yourself. Fingernails are a breeding ground of potential diseases, and the subungual region, the area under the nail, harbors higher concentrations of microorganisms than other areas of the hand. Persons with artificial nails and long nails have a higher tendency to harbor pathogens due to increased nail length and the acrylic material. Pathogens primarily associated with artificial nails are Staphylococcus aureus, gram-negative bacilli, and yeast. Pathogens can potentially enter the host body at either the initial entry site or at parts of the body where they are not easily found by adhering to host cells, which is typically the most common. First, pathogens enter the host body and attach to specific host cells. Once pathogens adhere to host cells, they invade, colonize, and attack the host tissues. Most tissue damage occur due to production of toxins from pathogens. The produced toxins get spread to other tissues via the circulatory system and can potentially damage the heart, liver, and nerve tissues. The transmission of the pathogens can depend on the species type, the number of microorganisms present on the infected surface, inadequate hand cleansing, improper use of gloves, choice of hand cleansing agent, and/or the skin moisture.
The types of infectious diseases that have been colonized and spread via artificial nails include staphylococcal infections, Pseudomonas infections, and Klebsiella pneumoniae infections. Staphylococcal infections are caused by the bacteria Staphylococcus aureus. The source of infection is either person-to-person contact or object-to-person. Symptoms for this type of infection varies, including skin infections, food poisoning, bone infection, endocarditis, pneumonia, and toxic shock syndrome. Pseudomonas infections are caused by the bacteria Pseudomonas aeruginosa. Symptoms vary depending on severity as well as the location. For example, if it's in the ears, symptoms include pain, itching, liquid discharge. If it's on the skin, symptoms include rashes and pimples. If it's in the eyes, symptoms include pain and redness. Klebsiella pneumoniae infections is caused by the bacteria Klebsiella pneumoniae. The symptoms vary depending on the infection that has been contracted. For example, if pneumonia was contracted, the symptoms will include fever, chills, coughing, mucus, shortness of breath, and chest pain. If a urinary tract infection has been contracted, then symptoms include urge to urinate, burning sensation while urinating, cloudy urine, back pain, and discomfort.
Direct patient care is defined as healthcare providers working hands-on with patients. This includes face-to-face interactions for diagnosis, treatment, intervention, and healthcare services. Healthcare providers see and treat multiple patients per day. This increases the risk of spreading diseases from patient to patient.
Because the most common form of spreading bacteria is through the hands, the way you wash your hands is very important. I can show you how. Wet your hands under warm water and apply soap. Rub your hands together, including the wrist, the crevices of your fingers and especially under your fingernails. You want to make sure to wash your hands for at least 15 seconds. Then rinse your hands under water and use a dry, clean paper towel to dry off. You always want to make sure to wash your hands before any patient contact or when donning gloves to insert invasive devices such as central venous catheter. You also want to always wash your hands after any patient contact, which includes any contact with bodily fluids, change of wound dressings, and upon removal of gloves.
CDC estimates that approximately 2 million patients in the U.S. obtain healthcare-associated infections, or HAIs. HAIs are caused by the transmission of bacteria, fungi, and viruses to patients from healthcare providers and healthcare settings. A study was done to assess the amount of bacteria under the nails of healthcare providers. These nails included long natural nails, acrylic nails, and short nails. The study concluded that 85% of healthcare providers with artificial nails and long natural nails contained bacteria as compared to the 35% of healthcare providers with short nails.
Due to all the case studies and information mentioned about the dangers of artificial nails, many healthcare facilities are now enforcing regulations for clinicians regarding nail hygiene. Today, hospitals and clinics are enforcing common policies in artificial nail enhancements. For example, the Loma Linda VA Hospital does not allow health professionals in direct contact with patients to wear artificial nails or extenders. They also have to keep their nails no longer than 1/4 of an inch. Since 2003, the University of San Francisco Medical Center specifically prohibits artificial nails even if gloves are worn over hands because they can cause tears. In 2014, Southern California Kaiser hospitals implemented their hand health and hygiene procedures that prohibits artificial nails. Regular nail polish may be worn, but it should not be chipped. However, they strongly recommend clinicians working in high-risk patient areas like ICU, pediatrics, the NICU, and oncology not to wear any nail polish.
Here are some toxic chemicals that may contribute to spreading infections. Camphor has been shown to trigger severe skin irritation and allergic reactions when applied topically and may cause yeast infections due to irritation around the nail beds. Studies also show that inhaling camphor fumes can cause nausea, dizziness, and headaches. DPB is a toxin that can cause onychomycosis, a fungal infection from nail bed due to inflammation from DPB penetration. Symptoms include discoloration of nail, thickening of nails, dry, scaly skin, foul odor, and can be transmitted through skin contact. BHA is a synthetic antioxidant and is a chemically made preservative. This toxin can weaken your nails and lead to something called paronychia, a skin infection which causes inflammation, swelling, and discomfort around the nail, and can spread through physical contact and touch. Symptoms include redness and tenderness of the skin around the nails and pus-filled blisters. That is why it is important when picking a nail polish to always read labels.
First, pick a salon that puts hygiene first. Ask yourself these questions next time you go into your salon. Does your nail technician have a valid license to be working? What do the nail stations look like? Are they clean? Another question that's good to ask is, does your nail technician wear gloves and wash hands between clients? And the tools that are used on your hands, are they left around the workstations? Another question that's good to ask yourself is, do the nail technicians reuse tools? And if they are, how are they sanitizing the tools? Another good thing for you to note as a healthcare professional is that you can practice safe beauty tips at home as well. Some of those tips are, don't forcefully cut or push back your cuticles. It's another area for infection to spread. My last tip is, find creative ways to stay sanitary. One idea is if you use manicure tools often or you visit the nail salon often, consider purchasing a set for yourself that is not shared by anyone else and is just yours. Good luck, health professionals! Oh wow, those facts were so good to know. From now on, I'll clip my nails and use regular polish only so that my patients can stay safe.
That's a great idea, and it looks super cute. Thank you, Cuticle Cops.